Welcome, everybody. I'm excited for you to be here today. Thank you so much for coming a week early, and we'll still have time together next week for some additional info and questions. But I woke up just very excited because you guys get to meet one of my very favorite people, Carey Miller, today. And so I'm going to let her get started, but we're going to actually begin in prayer and then Carey, I'm going to say just a little bit and then let you have the floor, my friend. I need you to have all the minutes because they need to learn all the things. So let's open in prayer this morning. Lord, thank you so much for another day. Thank you for allowing us to wake up and to be able to just continue your mission, Lord. I just pray, Father, over Carey today. Lord, I pray that our hearts are open to hear. You have created our bodies, and they are such an amazing work. And Lord, you have also given others wisdom and how we can move forward in this season of life, Father, with the ability to not feel defeated. And Lord, I thank you for Carey and what she's going to share with us today. I pray for every woman that is here live and for those that are watching the replay, Lord, that you will just fill them and give them what you have for them today and moving forward. Lord, thank you in your name. Amen. Well, just a little bit about Carey. I don't know, Carey, what, 7, 8 years ago?
Mhm.
I'm trying to remember. I had actually gone in to have a preventative check on my veins, and I was introduced to this doctor who actually prayed over me before he did just a simple procedure on my veins. And I'm like, okay, that check, I really like him. And at the end, had nothing to do with veins, but I just felt so led, and I was at rock bottom. And I said, do you happen to know anybody that does bioidentical hormone replacement therapy? Because that is what I'm missing. And I was just not myself. And he said, just 1 second. And I thought, well, okay. He literally went down the hall, got Carey, and she was standing in front of me 2 minutes later. And I'm like, okay, that's a miracle. And her office just happened to be in the same building as this vein clinic. And it was just unbelievable. So that was the beginning of a beautiful relationship. And Carey has helped me so much. And as a functional nurse practitioner, she's all about optimal health. And it's not just about one size fits all. And that is what is so important to me because there are so many out there that just want to treat you like anybody else. And that is not what you need. And so Carey was conservative with me, and we tried different things. And slowly but surely, I started to feel like myself again. And it's not that I want to be my 35 or 36-year-old self, but I want to be a healthy 56-year-old, being able to do the things that I want to do with my grandkids, with my children in life, and be able to look in the mirror and just say, okay, I recognize myself again, because it's not about vanity, but it is about just feeling defeated because you're doing all the things and yet nothing's changing. So that's where Carey comes in with all her wisdom. So, Carey Miller, my dear, dear friend, I'm going to pass it over to you and I'm going to mute myself out. You have the floor.
Okay, perfect. So, one thing that hasn't changed about Tammy, even though she's changed internally, feeling better, visually, she is changing. She's aging backwards, but she has this vest that she always takes her pictures in, and she does it on like a yearly basis of still improving, still doing great. And the vest always happens to be worn on that day, and it's not a planned thing, but she was like, this vest, I haven't changed out the vest. So, but it makes us chuckle. So it keeps us real. And I'm so glad and honored to be here today with you guys. So I am going to share my screen. Okay, can you guys see the screen for the slideshow? Okay. So I'm Carey Miller. I am a nurse practitioner, and I work in Hickson, Tennessee. And we do see patients virtually. And we are also able to take care of patients as long as there's state guidelines on which state you're coming from. But some patients do come in and see me on a like quarterly basis or once a year basis, just to make things be more personal. And that's what you're going to learn at the very end of this, that everything is personalized to you. And I want you to feel yourself again. I want you to not settle. I want you to advocate for yourself. And listening to this will allow you to understand more about hormones so that you can advocate for yourself to feel yourself again. I have been practicing preventative holistic wellness for 13 years. I'm a family nurse practitioner that has gone into additional training for hormone optimization and insulin management, insulin resistance, thyroid optimization. And you really need to find a provider that is going through education on a continual basis, because all of this changes from year to year. So you want to focus on a provider that has gone through that additional training, because most of the things that we're going to talk about today is not taught in your basic family nurse practitioner or your OBGYN's training. So that's another side piece that's super, super important to have that be part of your care. So what is optimal health? Optimize You is where I'm at, and I have used the word optimal health for years, and it is concierge medical practice focusing on your hormone optimization plan. Normal labs are not optimal. You have to feel good, and we focus on hormone health, weight loss management, thyroid optimization, insulin resistance, and anti-aging for women and men. We start off with a fasting lab draw. You can call to schedule, or at the end of this presentation, there'll be an email that you can email, or you can text in and get an appointment. You can even book online. The scheduling of the labs is a comprehensive medical lab panel in addition to a consultation with the provider. So it's $149 to get started, and there's no strings attached to that consultation. It is just allowing you to get your labs done and then having a sit-down conversation with the provider, customizing the treatment plan based on your medical history, your lab review, and your symptom review. And we kind of go through a tiered effect on how I think you could benefit based on what your labs are telling me and what your symptoms are presenting with. And then you can start the program if you choose. It's a concierge medical program. Everything's included in a membership, and the membership is tiered based on what you need. And the medications will be included. All your follow-up consults are included. Your labs are included. We try our best to be the full picture and not have any added extra expenses outside of what we are doing in our practice. Hormones are not 100% FDA approved for women in certain categories. So that's where we do everything concierge. We don't file insurance because they won't cover your care. You will get stuck with a bill after the fact, and that's what we don't want to happen. We want you to be 100% covered and feeling good and overall seeing improvements as we go along. So optimization versus normal. You might have gone to your practice of your primary care or your OBGYN and told your labs are normal. You just have to deal with it. Or it's just perimenopause. You're going through the change. Or welcome to menopause. This is it. There's not much options given to you as a woman, because the patient population's labs, the same age as you, will go all the way down to 0, and that's considered normal. And you don't feel normal. You feel like you're on ground zero. And having that be told to you is so deflating, and it needs to be understood that that isn't normal. That's where disease process will set in. That's where the aging process can set in. And optimal lab results means symptom relief, disease prevention. And you want to make sure that your provider is listening to your symptoms and advocating for you. You are advocating for yourself, and that you are getting a treatment plan that will make you feel better. You never want to settle. You never want to be told that just deal with it. It's just menopause. It'll get better eventually, because you will live through that for 10 to 15 to 20 to 30 years of feeling miserable. And that's what we're going to talk about today, is giving you the confidence that you can advocate for yourself so that you can feel your 30-year-old self again. Anti-aging means stopping the aging process. It's crucial for disease prevention. We in the medical world have gotten to where we wait until the disease happens before we act. And that's what made me go into anti-aging care. I was an ICU ER nurse. I saw what disease did. I saw these healthy individuals coming in for hip fractures, for massive heart attacks in their 50s. And I'm like, what is going on? And in my brain, I'm like, why are we not preventing this ahead of time? And when you think of the process, that time in our life is when we don't have hormones. So why not give back their hormones so that they can continue to age gracefully and feeling good as they're aging? And that's what's super important with hormone optimization, is you have to get your levels back up to your 30, 40-year-old self, and not just a little bit saying, oh, that should be good. You want to make sure that your symptoms are good, your labs look good, so disease could be reversed or prevented. So this is a normal range of hormones. Average hormone production for women will peak around the age of 30, and that's whenever you're in your prime, you're having your kiddos, and then you will drastically lose your estrogen, and your testosterone will drastically lose too. But do you see the bell curve for men is a lot more subtle? For women, it's a peak and a fall. And that's what's important to know, is you have to catch that fall before you are falling off the cliff, and that's menopause. And you can ride the cliff a lot better through perimenopause treatment. So there's 3 different types of hormones that we specialize in for women, and the 3 are used in conjunction with one another. Testosterone is huge. Most of the lecture today is going to be on the benefits of testosterone, because it's the unwritten rule for women. It's the hidden medication for women, and it is so needed for you and how you feel. Estradiol is definitely important as well, and progesterone is also neglected for women, because you won't be given progesterone unless you have a uterus or you are pregnant, whereas we need progesterone for a lot more things, and that's what we're going to go into as well. So estradiol is beneficial for heart disease prevention. It will naturally lower your cholesterol. It will help with your brain health and memory. It'll also help prevent osteopenia and osteoporosis. As you age, you fall, you break your hip, or you develop cardiovascular disease, and that's due to the lack of estrogen. So by giving you back estradiol, you can actually prevent the cardiac disease. You can prevent high cholesterol. You can not go on a statin for your cholesterol by giving yourself back your estrogen. It'll also help with your libido, and it'll help with fine lines and wrinkles, and it'll also help regulate your insulin sensitivities, which will help with the belly fat area. Progesterone is given in conjunction with estradiol. It's beneficial for all age women, even after a hysterectomy. You are taught in the medical world to only give progesterone for the uterine protection. So if they give you a hysterectomy and you no longer have a uterus, they think, oh, you're good, you won't bleed. But you still have breast tissue, you still have brain tissue that we need to protect as providers. Progesterone is what helps with sleep. It's our calming hormone. It helps you get rest at night, deep REM sleep, so that you wake up well and ready to go in the morning, not fatigued and foggy. It'll also help with our younger ladies with PMS and fertility and maintaining a pregnancy or getting pregnant. And it protects your breast tissue from getting densities within your breasts, which can ultimately lead to cancer prevention of breast, uterine, and ovarian cancer. So you want to make sure that you're taking progesterone. Progesterone is not progestin, and it's used interchangeably between many providers, but it's totally different. It's bioidentical plant-based progesterone that we use. It helps with anxiety and depression. You might find as you're aging, you're getting very anxious or you're getting very sad because you're looking in the mirror, you're seeing a different person, you're feeling like garbage, and you're being told to just keep doing it. It's okay. You're not sleeping. So you go to your doctor and they give you an antidepressant or an anxiolytic, which is now another medication that you're having to take that's an addictive medication that's not treating the underlying cause. And the underlying cause is most often progesterone. And it's also helping with migraines and headaches. I have treated many ladies that come in with chronic migraines, or they will have a migraine every month around their cycle. And then when they get into perimenopause, their cycles become erratic. So their headaches are every day or 5 or 6 times to 15 times a month. And by giving them a low dose progesterone, it can correct their migraines and they can come off their headache medications, which is huge. Testosterone's the other medication that I give all of my women. Testosterone helps with intra-abdominal fat. It helps with fatigue and brain fog, joint pain. It helps with bone mass. It is the structural support that you need for your skeletal system. And it'll also give you back your sex drive. I've had several ladies come to me and just say thank you for giving them their spark back, their interest back. Sometimes as you are aging, you're married, you're happily married, you love your husband, but the last thing you want to do at the end of the day is have sex because you're just too tired, or it might hurt, or it's just not in your forefront. And then you feel almost broken. And that's what testosterone can give you back, is that spark that you just need so that you can actually have a healthy relationship with your husband and feel valued and feel confident in yourself, because it'll also help with your belly fat area and muscle tone strengthening and overall just feeling better with testosterone. So testosterone for women helps with joint pain. Have you ever thought that shoulder pain or frozen shoulder or plantar fasciitis or itching could be menopause? Because most of my patients are like, what? I had no idea. That's the lack of testosterone. And joint pain and body aches are the number one thing that does improve, because it helps maintain your muscle strength. That gives you back your skeletal structural support. And it also helps with strengthening of the bones. Your midsection weight gain will improve with testosterone because it targets your visceral fat. We're going to show some pictures here in a little bit that'll show you the before and afters of just testosterone replacement. Like I said, it helps with libido, and then it'll also help with the energy level and forgetfulness and fogginess. Your sharpness might go away. You're going into a room and you're like, why did I come in here? Or I work with her every day and I cannot think of her name. Or I need this off the desk, but I don't know what it is. A pen, like those sort of things. And then you're like, oh my goodness, do I have dementia? Is my memory fading? And that's a fear that we all have. By giving you back a little bit of testosterone, it can correct that, which is huge. So this lady came to me. This was well before GLP-1s. Now, if anybody is shrinking around you, it makes you think of what are they taking. This lady, I dug back a little deeper into my archives of patients, and this is just hormone optimization because I wanted to give you a clear picture. The GLP-1s we're going to go into in just a sec, but they are definitely helpful. But you can correct visceral fat with hormone optimization. This patient dove into her diet. She dove into her exercise. She was on a Disney trip with her family. Didn't have really good pictures because she didn't like to be in pictures. She was always hiding behind her family members. So this particular before picture is a trip of Disney. And then this is now her on a visceral fat gone. The profile will shrink from the testosterone. And that's what optimal testosterone levels give you. It'll give you back your 30-year-old self. Whereas if you go on a diet and exercise plan, you're doing the part on your end, you should see the results. That's what testosterone does. And it'll target that midsection weight gains pretty significantly, which will then give you also the energy to go in the gym and work out as well. This patient came in, had a hysterectomy. Visceral fat is this particular fat that you see here on the upper skin. You see the profile is wider. This is 1 month after a pellet insertion of testosterone. Testosterone can be done many different ways. It can be done via an injection, via cream, or a pellet insertion. A pellet is an insertion that I do every 3 months, and this is the visceral fat just shrinking with just the hormone optimization post-hysterectomy. So the hormones facts checks. Tammy and I were talking about, what is some good things to talk about, and often hormones are feared or they're misunderstood. Everyone seems to think that hormones can cause breast cancer, and they are actually removing those studies that we've known for a long time to be false. The WHI study came out in the 2000s and everybody was stripped of their hormones. They're actually saying now you can continue taking your hormones and they're safe even after having cancer yourself. Even if you've had breast cancer, you're still a candidate for hormones. And that's what you need to know is those studies that we once feared are now being chosen of actually it was 7 out of 10,000 women that developed breast cancer. And we're actually going to pull that study because now we're going to admit that the media took that study and ran with it. It wasn't a true study. And it was on synthetic hormones. It was not done on the plant-based bioidentical hormones that we are using every day now. So that was definitely an outdated study that has starved many women and your moms from hormones themselves, which is so sad to see how they have lived a life of menopause and disease that could have been prevented had they not released that study. Many people often think, I'm too old for hormones. That ship's already sailed. I don't need hormones. I'm 70 years old. It's okay. You're never too old for hormones. The sooner the better. Definitely you want to make sure that you're advocating for yourself. And when a provider tells you that you're too old for hormones, that's not the right provider. Menopause is just hot flashes. Menopause is many, many, many different things. That's why, joint pain, foggy brain, belly fat, tired, crashing at the end of the day, needing a nap, plantar fasciitis, your skin itching out of your hands, sex becoming painful. That's menopause, and it can be prevented. Hormones must be stopped as soon as you're 65 years old. The Menopause Society has actually admitted in April of 2024 that is false, that you need to stay on hormones. You need to stay on your estradiol. Estradiol can decrease your mortality by 19% by going on estradiol and staying on estradiol forever. It will decrease your breast cancer risk by 16%. Why are we not continuing on estrogen? Estrogen is so feared, but it's so needed. And that's what you need to understand, that it's okay to continue on your estrogen, progesterone, and testosterone until you're aging gracefully. Like there's no reason you should stop a hormone unless you have an aggressive type of cancer that the hormones could potentially be worsening, or you have a condition that doesn't qualify you for hormones. There are slim that we can do some and not all. We do choose those wisely, and it's a patient specific that we go that route. But I think that hormones are needed all the way through aging process. Insulin resistance is huge. We as a society are using a high carb diet nowadays. We are a meat and three generation, and the threes just keep getting bigger. You want to make sure that you're eating protein as you are aging. We become very sensitive to the insulin, which makes us hungry, which makes us develop into pre-diabetics, and insulin management is not being managed. It doesn't even have a diagnosis code. But we are seeing many patients that have a high insulin, and type 3 diabetes is becoming more prevalent, and that's dementia. So it's important to know about insulin and treating your body appropriately for insulin, and that's through a high protein diet. This particular patient came to me riding parks in a scooter. She loved Disney, but she didn't want to miss out with her family. So this particular first picture was her on a scooter. And then she went back and recreated that memory on the ledge, 150 pounds lighter and feeling her best, all through insulin management and hormone management. This was through multiple medications and lifestyle changes. And then she sent me this little gem over here of her running a race at Disney. I know that is a huge accomplishment, and I've had other patients do that. I love getting those post-marathon, post-5K pictures that are so important for you as a patient to give you that confidence back. GLP-1 peptides make the insulin resistance a lot more manageable. Metformin is helping as well. GLP-1 peptides are not for everybody, but they do help with the process of the insulin being broken down so that you don't have those sugar cravings, and they actually can help you lose your weight in a healthy manner. Next up is thyroid optimization. It's crucial for metabolic health. Thyroid manipulates every cell in your body. You have to have a good functioning thyroid, or you won't be able to go from first gear to second gear to third gear. Your engine will always run in first gear, so everything is slowed down. And that's what's so important with thyroid, is you have to know, is my thyroid working? How do you feel? The symptoms of low thyroid are depression, brain fog, fatigue, muscle cramps. You're always cold. You're having unexplained weight gain. If I put you on hormones and you're still gaining weight, or you're not feeling 100%, because as you see, many symptoms will overlap, then I will look back at your thyroid and I will say, actually, you're low normal, not optimal, but low normal. And that's where sometimes adding a little dose of thyroid can be all you need to rev that engine up so that your metabolism is working better. And we give desiccated thyroid. Desiccated thyroid is a combination therapy. It's not Synthroid. Everybody is prescribed Synthroid for thyroid disorders, but that doesn't do anything for your active thyroid. Your body must convert that T4 over into T3 to get symptom relief. And majority of the population is not able to convert. So we give a desiccated thyroid that has a little T4 non-active and a little T3 active, so that you can actually feel your best and actually manipulate those cells into running your engine at a higher gear. So if you're currently taking Synthroid, you might ask your provider, or you could come see me and we can get you on some desiccated thyroid, and it should instantly give you back your energy. And of course, last but not least, I can't leave out Juice Plus is a great nutrition. I always promote Juice Plus for nutrition. And it's just a capsule form allowing you to get the fruits and vegetables that you need on a daily basis without adding all the calories and all the steps that it takes. And the omegas are huge for heart, brain, joints, skin, and eyes. They are definitely needed. And that helps with cholesterol. It helps with cardiovascular protection. It helps with overall well-being of your skin. And I love a good liquid collagen too. Liquid collagen can go a long way. I do a liquid collagen through an online ordering service that I can definitely hook you up with. This is day one. This is 18 days later of the neck. So, and this is just a drink once a day. And it definitely makes a difference in how your texture of your skin looks. So I will then turn it over to questions.
Feel free to unmute yourself to ask any questions.
Just how do we get a hold of her?
Yes,
I
yes,
know you want Carey in your back pocket. There you go, right there.
Can you come to Florida?
yes. So my Florida, y'all can carpool. I have several patients that come up and they come and they do a 3 month free check, or we can ship medications to you and you can still utilize the services via virtual visits. So
Hmm.
yes, you can reach me on Instagram. I have an Instagram account, Carey Miller NP. Our phone number is listed there on the screen. And like I said, we are in Hickson, Tennessee. There's optimized use centers all over. You can look up optimizedusecenters.com and you can find a location near you. We are all trained similarly, and we do require a one-time visit in person, and then we can do visits from your home otherwise, or you can come up and make a girls trip out of it. That's what we've learned works best for most patients. And they like visit on a quarterly basis or just a once a year basis. So
And it's so worth it. There are other optimized U's, but there's not any more Careys. I'm just, I'm a little
yes,
biased.
love that.
Carey is such a godsend. She loves Jesus, and I'm just so thankful for her friendship and also for her expertise in my life, as I know hundreds and hundreds are also. So, Carey, thank you so much. Thank you,
Thank you
everybody,
guys for
for
having
joining.
me.
All right. Have a great rest of your week, everybody. Make it a great
Bye
one.
bye.
Bye, Carey. Thank you.
You're welcome.